Let me get to our guest, William Lajeunesse from the Fox News Channel, who's been covering a story that's developing out in California where they kind of want to go their own way on healthcare. William, how are you, sir?
I'm doing good, Mark. Thank you. So, they passed out of the California State Senate a bill which would establish a single-payer, government-run healthcare system out here. No copays, no deductibles, free healthcare for everyone, including people who are here illegally. Problem is, it's about $400 billion, which is about 30% more than the entire state budget. So it's really expensive, and they have no way of paying for it. But still have to pass the assembly, and then, of course, go to Governor Jerry Brown. But, of course, the argument is on behalf of a very blue state.
Right.
And these liberal Democrats in Sacramento is, hey, what we have isn't working, and it's expensive, so let's try something else.
So we saw today where Aetna, for example, is pulled out of Ohio. Do they have that problem in California already with these exchanges? Have they had companies bailing?
It's not quite as bad, but people do have a problem if they're on some exchanges to find a doctor who's willing to take some of the reimbursement rates, which are not as lucrative or generous as maybe some of the private healthcare groups. But, all the large employers will be out of business. No Blue Cross, no Aetna, no Kaiser. All the insurance companies will go out of business because it would be run by the state.
Wow. Were they planning on funding? Have they talked any specifics? Were they going to fund it with part of the money they get for Medicaid or Medicare? Or did they say?
It's going to be, they're going to use all the existing sources. So, the money that the state currently contributes, the federal government share, the private insurance, or rather the private employer's share of that, what we pay, and then on top of that, there'd be another 15% payroll tax. So
wow,
it would be phenomenally expensive. Now, one thing the Democrats are saying, hey, listen, this is a long way off. We're really sorry, but we need to have this conversation because healthcare in America is a right, and it's not working. So here's the interesting thing, I think, from a more national perspective, because a lot of America could care less about California for good reason. But, that, and I didn't know this, but 112 House Democrats in Congress in Washington have already signed on to a single-payer bill sponsored by Representative John Conyers of Michigan. And New York, New Jersey, Rhode Island, and Massachusetts all have single-payer bills in their states. And what I'm being told is this is a conversation. People should get used to the terminology of single-payer because you may hear it in next year's midterms, but you'll definitely hear it in 2020.
I'll bet. Yep. That's the politics behind it. I appreciate you explaining that. William Lajeunesse with the Fox News Channel. We'll look for your report. Thank you.
Thank you, Mark.
All right. Appreciate the call, and good to get him on there. Can you believe that? I had a very interesting conversation with a retired surgeon this past weekend, and it dealt specifically with this idea of health insurance and the reimbursement problems that he faced prior to his retirement, right? He said that if he took a Medicaid case, that the reimbursement for the physician was about 10 cents on the dollar. So if it was a Medicare patient or somebody with private insurance, he was getting $1. And if it was a Medicaid patient, he was getting 10 cents. So that kind of put in focus for me the problems the doctors are facing and why so many of them refuse to help Medicaid patients. Do you have any idea what a single-payer healthcare system in this country would mean? It would be a bureaucratic nightmare for that very reason. I mean, Medicaid is for the poorest of the poor. I understand that. But there's no equivalent health care. If it's the same procedure they're paying for under Medicare, where people are paying a premium each month for that coverage, but under Medicaid, where they're not paying a premium because they're too poor, but the government's providing the health care, they want to reimburse doctors for the exact same procedure at 10 cents on the dollar. let me ask you a question. I mean, I went to I was on the 5-year plan. I went to college for 5 years, and that's mainly because I switched universities in the middle of it. Physicians go to school for how many years? 8?
Yeah, something
At
like
least. And then they've got residencies and all that. I mean, some of them are 30 years old in their late 20s before they're ever practicing. And some of them, and I know this from personal experience because of a friend, come out of medical school these days with $300,000 or $400,000 in loans that they've had to go through to go to medical school. Who in the world would subject themselves to that, to then work in a healthcare system like the one that might happen in California, or God forbid, a single-payer system in this country, where the government bureaucrats are going to dictate the amount of money you can make per procedure? You know who I want to be the highest-paid people in my life? The guy that's going to operate on me and the guy that's flying my airplane. Mm-hmm. I don't care how much money those two people make. I want them to be the best people in best paid, and I want them to be the best educated. Right? So that just starts to scratch the surface of the problem with a single-payer healthcare system. And that's what these liberals, these Bernie Sanders progressive liberals, are pushing for. Plus, you had Chuck Schumer saying the problem with the expense of healthcare in this country is that we need to put all the doctors on a salary. Can you freaking imagine going through 12 or 14 years of schooling plus all of that to be told by the federal government what the cap is going to be on your ability to make money next year? I'm sorry, we're going to limit you to $150,000 a year because the economy's tight right now and we can't afford to pay you anymore.
I have another place we can tighten our belts.
Where's that?
The same people who are saying we need to put doctors on salary.
Yeah, thank you.
Plus a 15% more. Like when that hits people's pockets.
Well, California's already got to be the highest tax place in America.
Right. And then another 15% on top of all that. Are you going to even have like a paycheck?
It's all. I mean, I see. I'm glad that William Lajeunesse and a lot of reporters aren't going to go to the trouble to draw your attention to that. But his point was, there's a bill in Congress. There are bills in several state houses across the country in blue states where they're trying to get people used to this idea of some sort of a single payer system. Where the ones in California screwed up is that they let somebody attach a cost to it.
Right.
And people realize the cost of a single payer healthcare system in California would be more than their entire budget right now.
Right.
More than what they pay for education and everything in California.
Yeah.
More than that.
30% more.
Yeah.
From what he said.
Yeah,
and didn't he
unbelievable.
say this covers non-citizens as well?
Of course. And here's the thing about it. If you're stupid
Why
enough,
do I want to work anymore?
if you're stupid enough to sign up for a system like that in California, honestly, we should probably let them do it because they'd be bankrupt in a couple of years. But every homeless person and every poor person in America would then move to California. Now, maybe that would facilitate it breaking off a little sooner into the ocean. We wouldn't have to worry about it.
Yeah.
I'm just saying. It's a thought. I've thought about fencing it off, but I'm not so sure that would work.
Okay, let's not let them know that. Let's just let it happen.
Steve, what's on your mind? Thanks for calling the program.